Hello and welcome everyone. I am Haider Ali Salim, a fourth year medical student and the convener of the Student Psychiatry Interest Group here at the Aga Khan University. Recently, a campaign by the name of Choose Psychiatry has been started by the Royal College of Psychiatrists in the United Kingdom, where they feel they face a dire shortage of people in the profession. Staggeringly, the United Kingdom has a population of 66 million served by 8,800 psychiatrists. That is, one psychiatrist for 7,500 people. And understandably, they've declared it an emergency to recruit psychiatrist trainees. Whereas in Pakistan, we have a population of 200 million served by a total of only 420 registered psychiatrists. That is a staggering 500,000 people served by one psychiatrist. And so, this video is part of our series Pak Needs Psych, where we interview inspiring personalities of the profession and hope to cultivate an interest in the profession, hope to answer any queries you might have, and most importantly, simply we want to get to know our own doctors of the mind. Our guest today, born and raised in Karachi, is from the AQ class of 1998. She went to the University of Texas, Houston for her adult psychiatry residency and pursued her child psychiatry fellowship from there as well. Further, she joined Baylor College of Medicine in 2006 as assistant professor and was promoted to associate in 2012. However, she came back to the Aga Khan University, Karachi in 2013, and she joined as the chair of the Department of Psychiatry. Today, presently in 2017, she is also serving as the Dean of Students at the Aga Khan University. Our guest today is Dr. Ayesha Mian. Welcome, Dr. Ayesha. So when did you know that you wanted to pursue psychiatry, and what about it appealed so much that you knew?
So I always wanted to, my parents wanted me to be a doctor, but I always wanted to be a journalist. I loved literature. I wanted to, do something where I understood how people's minds work. I remember I think during my O-levels when we were studying Macbeth, I was first introduced to the madness of the human mind. And it fascinated me from that time, just trying to figure out, what makes people tick, what makes them angry, what makes them sad. How is it that the same person could be such a wonderful person and do the right things and yet get to a point where they're doing something that is completely antithesis to what they are. So the good and bad existed in the same person. And that, I think, I had already developed that curiosity about how the human mind works. And I also wanted to continue being creative, and I feel psychiatry allows you to do that. Every patient story is different. It could be the same major depressive disorder, but how they reach to getting that stage is different. That interested me. And I also felt a little bit like a detective, like you've got to work with your patient over a long period to really sort of get all the pieces together, eventually getting the right story and understanding. And that also was an intriguing, curious way of looking at medicine and working with people. So I think it just fit.
So now you come forward and you've declared your intent to do psychiatry. What were the reactions at home, around you?
So, I was worried that my parents will, freak out. Literally, I think there's no other better way of explaining it. But I think they were so concerned with me complaining to them about coming to med school. There were times when I would go back home and say, I can't keep doing this, I'm quitting and stuff, that they were happy that when I told them that I've actually found something that I would like to do.
Give some advice to all those students out there who are pretty sure they want to do psychiatry, but don't pursue it because they're scared their parents, and they know their parents won't accept it or their relatives won't accept it.
So I will tell this to all the students that eventually it's about what you do well. Okay? If you take up something that you really don't enjoy, you'll be able to do this well for a bit, but you'd get burnt out very quickly. So burnout is a very it exists in medicine. It's a harsh reality of medical students, of doctors. There's a lot of articles being written about, physician burnout. But it happens more to people who are not doing what they really want to do, who are not pursuing their vocation. So parents not liking what you're doing, it's not attractive enough, let me use the word sexy, it's not sexy enough, it's not that you're doing neurosurgery, cardiology or cardiac thoracic surgery. But once they see that you are happy with what you're doing, and that you do it well and you're successful at doing what you're doing, families and parents come around. So yes, it's an initial bump, but it's not something that you can't cross over. You don't want to get into something that's going to be a lifelong bump. So I think you just need to put things into perspective around that.
Precisely on that note, did it ever bother you that in most people's eyes, it didn't carry the same swag level as, for example, some other specialty like surgery?
But what bothers me more is the stigma within physicians, and just that acceptability of what we do, and the kind of work that we do. I've still got friends. I have colleagues and friends from my own class and the class before me from AKU who will still ask me, are you a psychologist or a psychiatrist? They've gone through medical school. Psychiatry is one of the mandatory rotations at AKU, and yet they still don't get it. So, and it bothers me. It still bothers me, and I fight it. I work around it. I figure out creative ways of working around that stigma. And one of the things that was my primary vision when I came to AKU as chair of the department was to make mental health applicable to AKU and the hospital.
So lifelong barrier kind of a situation.
Mm-hmm.
So on a lighter note, tell us about some memorable anecdote from back in the days at AKU.
So memorable would be, again related to psychiatry, but I had a very close group of friends that heard me whine and crib and cry for the first 2 years that I don't want to do this, I want to leave, this is not good. And they were very good friends, so they didn't want me to leave. So they would, console me, thodi der aur dekh lo, wait for a little bit, this is going to get better. So one of my very best friends in my class, he actually did the psychiatry rotation before me. And I was going to follow him 1 month later. And I remember the first day that he went to clinic or went to the psychiatry rotation, and I was sitting in the quad with some of my other friends, and I see him running back into the quad saying, Ayesha, I have good news for you. Ayesha, I have excellent news for you. And I'm like, what happened? And he goes that, you're going to love psychiatry. You're going to be all right. You're going to be all right. Psychiatry. I've gone through the first day, and this is going to be great, and you'll be fine. You'll be fine. Don't worry. And that still, I tell him this. He's forgotten all about it. But it was just wonderful that my friends also knew me, perhaps more than I knew myself, and they had picked up that this is something that I would enjoy doing.
Right. So after med school, the next step was training.
Right.
You went abroad to train. How does that work out? Was that a common practice at that time?
My fiance at that time, he had already started, he was a year ahead of me, and had started his PhD program in the US. So I figured that that's where I'll have to go. So took the US MLEs, took that year off to do my interviews and all, and then started my residency in the US.
So next up, that is what I was going to ask. How did that align with personal life? Because especially for a woman, that'd be a very important question at the end of med school. So were you and your fiance at the same place?
So this is an interesting question you ask, Heather, and I really do want to bring this up because one of the things that happened during my interview trail was that I was offered a pre-match at the Mayo University, which was at that time the top 4 or 5 programs in psychiatry. My husband, because we'd already gotten married, he was in Houston. He was at Baylor College of Medicine doing his PhD in human genetics. So I made a decision at that time to not take that offer because to me it felt like being so far away, opposite ends of the US is going to be very hard for us. And I matched at University of Texas, Houston. I knew the program because I'd done my electives there. I knew the program, I knew the people, I matched there, and it worked out really well. So, there was a time when I used to think that I said no to one of the top programs. What does that mean for my own career? But being in a smaller program actually was great because I was able to shine there very differently than I would have had at Mayo. So every time an award opportunity came up, I was the one who was asked to apply, and I actually was exposed because of that to a lot of organized psychiatry, both at the adult psychiatry level and the child psychiatry level, and was able to develop a lot of leadership skills within that. I got to be the chair, chief resident and stuff. So I think that worked out. So I do feel that if you do things for the right reasons, which feel right in the here and now, things work out in the long run.
That one hit pretty close to home. So on that note, tell us a little bit more about the residency program generally and your experience at Baylor.
So my residency program and my fellowship program were both at the University of Texas, Houston. The general residency program was a good one. It was very solid clinically, worked out well. I made some really good, very strong relationships with my colleagues there, with my co-residents. It was a hard program. So our call was, we used to work at the Harris County Psychiatric Center, which was a 700-bed psychiatry hospital. So when you were on call, you were taking care of all of the new patients that were going to be coming in, which is about 20 to 25 patients, plus the 700 patients that were already there in the hospital. So that was a killer call, and it was every 4 days. We have a 19-bed inpatient ward at AKU, so I just want to put that in perspective. So it was bad. So once those 2 years were over, we were like, everybody heaved a sigh of relief. And if at any point somebody needed to do an extra call as a third year, it was like death, even though we had done 2 years of it, but we were done. But what it did was that because you saw pathology and very, very severe pathology, it really gave you training like no other. And you saw all kinds of patients. So that was excellent. The child psychiatry program actually was one of the better ones in the US with some excellent mentors and teachers.
Tell us about a time you failed and that you remember it. And did it ever cost a life?
Oh, okay. So I don't know if it's a failure. For a long time I did see it as a failure, but the first time I lost a patient to suicide was very, very hard. So this was after I had finished my training, and I had my first job at Baylor College of Medicine at the Menninger Clinic, which is a sort of intermediate term facility. People stay there for about a month, 2 months. And I was faculty there, and one of my 16-year-old patients who had been very ill, she kept going to the acute psychiatric hospital for acute suicidal ideation, and then coming back to our facility, and then back again because you feel acutely suicidal again. And she killed herself while she was admitted with us at the Menninger Clinic. So she was on a 15-minute watch, and during those 15 minutes she hung herself with her guitar strap in the bathroom. And that was probably the toughest experience I've ever gone through. I think that the patient had decided that she was going to, because she was in and out of psychiatric hospitals just for suicidal ideation, that she didn't want to live. But for an absolute rookie faculty member, I mean, right out of my training, for the longest time I kept wondering if I could have done something differently. I worked a lot with my mentors in supervision to try to understand what happened. What I also did was that I wrote a book report on a new book that had been published on adolescent suicide. So that was sort of my way of intellectualization and helping myself get over it. But it's not something that you ever get over with. I mean, even till date, if any one of my adolescent patients is suicidal, all of them have my phone number, they have access to my WhatsApp, and I tell them just call me anytime. So I'm on call 24/7 for those patients because I don't want that to happen again.
How did that reflect in your personal life, this failure, having to see this? Did it affect the people around you? Did it affect Dr. Asad? How were you around the other people?
So that was a hard time, Heather. I do think, I remember going back one day from work just crying all the way home. And I also remember my son telling me, and he was probably 5 or 6 years old at that time, at one point saying, you know, Mama, I don't like you anymore. And I picked that up. I figured that I was so stressed out and I was so conflicted with what had happened, and there was so much turmoil going on inside of me that I hadn't really processed that he had picked it up. And you know, not that I had said anything, and not that in my mind I was doing anything overtly different with him in terms of spending time with him, but he had picked it up. And so yeah, for a time I do believe that it did. Things come around, so these are all, you know, phases that you go through, but it was hard.
Right. So apart from this acute phase, apart from this tragedy, how does being a psychiatrist affect your personal relationships? Often you see in the movies people talking to a friend who's a psychiatrist, telling them, stop analyzing me, stop giving me psychotherapy, stuff like that.
Right.
How have you seen it to affect people around?
So I want to bust that myth. I can't read people's minds. Okay, so the first thing that happens is that anybody who hears that, oh, you're a psychiatrist, you're probably going to read my mind. I can't read people's minds. So, you know, it's like, I pick up body language. I pick up if somebody is generally anxious or nervous or confident or happy. I'm attuned to picking those things up. So yes, I do. But until you tell me what's going on in your head, I can't do that. So I want that to be the thing going out from me, that, you know, every time people say something like that, I think it's important for us psychiatrists to let people know that, you know, this is not something that is going to happen just on its own. You have to talk to me for me to be able to understand where you're coming from. Now, how does it affect? Yes, I do, which is not a good thing. So at some point, you know, especially with close family members, my psychiatrist brain kind of, you know, just switches on all the time. I have my husband, Asad, always telling me that you need to stop analyzing me. Everything is not about, you know, my life as a kid, and everything is not about, you know, how my parents raised me. But that is, you know, something that happens just being in this profession, that it's an occupational hazard. But you've got to be careful and mindful about it, that you're not doing it all the time. I will tell you that being a child, having gone through child psychiatry training, has actually made me a better mother. I do feel that it's given me a perspective on children and how we don't need to take everything seriously. Also, I see a lot of very severe things coming to my clinic. So my kids feel okay, even when they do a little bit, you know, stuff here and there. And also, you know, when my friends come and say, oh my God, you know, my kid is doing that, what's wrong? And, you know, am I a good mother and stuff? I always tell them to chill, that you're good. You know, your kids are okay, you guys are okay. So a little bit of turbulence, ups and downs, I am able to see them as just phases that we go through and not necessarily pathology.
We'll often hear that, for example, people who want to train abroad, they will face, as psychiatrists especially, they'll face an ethnic barrier, or they'll face a racial barrier where a Gora or a white man won't want to open up to a Pakistani psychiatrist. Have you ever faced such a thing in your life?
So no, that's not true. You know, people who and that let me just take that back, you know, take a step backward over there. That it's just this is not just about psychiatry. Even overall with medicine, you know, you can ask this question of anyone that is a person from a different race uncomfortable with working with a physician from another race. Also, let's say a male patient, is he concerned about having a female therapist or a female psychiatrist, and vice versa. So that may be a very short initial hindrance, because everybody has unconscious biases and everybody feels like I can talk better to this person, or this person will understand me more. But, you know, once you're able to develop a therapeutic alliance with your patient, regardless of what specialty, I think that barrier gets, you know, struck off very quickly.
So roughly 10 to 12 years in the States, and then you found yourself back here. You made an active decision to come back. How has the experience been? Was it difficult in the beginning? How's it been?
So 16 years in the US, okay, and very well settled in the sense that kids were going to good schools, and we had a home, and, you know, all of those great friends, like family and all that. I think that we always wanted to come back, so there was always this sort of thing at the back of our minds that we're not going to be here forever. it had also started to feel a little bit stagnating because you were doing the same thing. And then I think that there was the sense that there are a lot more psychiatrists and child psychiatrists like me in the US. At the time that I decided to come back, there were 2 in the country, in Pakistan, one at AKU and one in Lahore. Now there are 4 of us. So I feel that it was important to come back. How has it been? So very, very honestly speaking, touch wood, not a single day of regret. It's been 4 years now and counting. There are ups and downs. There are days when I want to tear my hair apart, but that was happening in the US as well. So that has nothing to do with being in Pakistan. I do feel that there is so much that you can do here in terms of mental health, that you can pick up any small piece and you can make that your lifelong career. And if you get bored with it, then there's something else that can be done. And then, once you're done with that, then there's something else that you can pick up. So there's a lot of stuff is untouched, and there is a lot of opportunity to actually bring about change, which is not something that I felt in the US. So it's actually been a great experience. And the worry that people may not be as accepting about it, unfortunately, the prevalence of psychiatric disorders is so high that people come. We have patients. It's like my clinic wait time is about 2 to 3 months, which is not how it should be for somebody who's suffering. They want to be seen immediately, but it's just that there is a paucity of good, well-trained psychiatrists in the country.
Now a little bit for the medical students or even high schoolers out there. Practically speaking, as well as otherwise, why should someone choose psychiatry?
So I always say this to students, I say this to people think I'm very snooty about this, but I always say that, you need to be smart and intelligent to go into psychiatry. Okay, so if I see a very able, very smart student, I will say something like, you're actually smart enough to join psychiatry, so you should think about it. Okay, it's not an easy field, and you can become a good enough psychiatrist or an average psychiatrist, but to actually be able to make a difference, I think it's important that you have IQ plus EQ. Right? So you should be able to connect with patients emotionally as well. I think it's important to be able to do that. Now, having said that, there are lots of psychiatrists that just go the research route as well and not to clinical stuff, but there's so much advocacy needed, there's so much work that's needed, there's so much that you need to do outside the box when you become a psychiatrist, that you've got to be able to have all of that, or at least be open to getting trained in leadership and advocacy and research, in capacity building. So people who enjoy lots of different things. Why they should take this up? Because one, it's fascinating. It's very, very interesting. It brings you as close to a patient as you can. Sometimes I feel like it's such a privilege that these patients tell us things about their personal life that they will never tell anyone. Perhaps they've not even said it to themselves. Just very deep, dark secrets. And you're in that privileged position to be able to get into their minds. So just that to me is wonderful. It's a very humbling experience as well. So overall, if you're interested in psychiatry or even thinking about it, I think there is so much variety that you can pick and choose from. I can promise you that you'll never have a dull moment if you pick up this field.
So for the medical students, a lot of them have reported, this question has actually come into us.
Yeah.
They report that when rotating through this rotation, they feel that they've been exhausted mentally. Mm-hmm. And how do you deal with that exhaustion? What do you do to let it out and then go back home and try to be a normal person again, if that's what you're looking at all day long?
So, Heather, I'm glad you brought that up, because a lot of students don't enjoy psychiatry or feel like they want to do it, but don't because they feel that it's going to be very emotionally taxing for them. That's not true. That's how it is with every field that you may choose. So for example, you might decide to do surgery or you decide to do neurosurgery. You do know that with it you're going to be working, you're going to be training for 7 years, you're going to be working a lot more hours, you're probably going to be sleepless a lot of times you'd probably need to do a lot of research before you can get a residency in neurosurgery. So you choose that package, and you do it because you want to do it. So similarly for psychiatry, one, it's not necessarily true that you're going to feel emotionally taxed all the time, because you very quickly learn to pick up on the things that are getting better. You also learn that I can change this, but I can't change this. As a physician, this is where my limitations are. Beyond that, it's not about me, and it's not about who I am. I think that if you are feeling a little bit emotionally sort of overwhelmed, I don't think it's necessarily a bad thing. I think it's good when you have humans touch you and you go home and you feel bad. It happens in oncology. I mean, it was very, very hard for me in my child psychiatry fellowship when I did my rotation in pediatric oncology. We had to go, and our job was to talk to kids and tell them that they're not going to make it, right? So it was a very hard job, but we did it. And it was very fulfilling because you were making a difference. Nobody else was telling them. And let's say that their biggest fear was, is it going to hurt when we're going to die? And it was good to be able to tell them that, no, you're not. So that's okay. And if that, and as you go through your training, you learn how to deal with these things. You learn how to deal with your emotions. You learn how to sort of not necessarily compartmentalize. I think it will always be something that goes with you, but be able to say that, what is it that I need to do to help this patient? I can't start crying with them. But I feel that almost every good physician should do that. I think that every medical student should get emotionally overwhelmed when they see, a pediatric or an oncology patient, or whoever else. Doesn't matter. When they see death and dying in the ICU, they should. I mean, that's part of being a good physician. That's what compassion is all about. So I feel that's not something that should be a hurdle at any point.
So similar note, we got this question anonymously. The person writes, I have a lot of emotional baggage. Can I be a psychiatrist?
All of us have emotional baggages. So, partly we all feel as we come into medical school, they're the top of the top kids that decide to do medicine, right? So that's all, I'm being flippant here, but that brings in a certain amount of narcissism that, I'm the only one with emotional baggage, right? Everyone has emotional baggage. Everyone goes through hard times, good times, bad times. Sometimes for some people it could be a very small thing that, you look at it and say, oh, this is nothing. You're upset because of this. For others, it could be huge things in their families that causes them to feel like overwhelmed. But of course, I mean, having emotional baggage should not be the decision maker for the career that you're going to choose. You choose a career for very different reasons. You choose a career because you want to know that, am I interested in this, and will I be able to do this for the rest of my life? I enjoyed surgery, I enjoyed pediatrics, but I felt that, if I choose psychiatry, even 20 years from now, 30 years from now, I will still be enjoying what I do. I will still be coming back from my clinic, not cribbing and crying and not burnt out. Those are the things that you should think about in terms of, deciding what you need to choose as a career.
Right. Where do you see the field in the next 10, 15 years? What's the scope in Pakistan?
So the scope in Pakistan is huge. We're just starting. We're just barely scratching the surface here. We've just started the first ever child psychiatry fellowship in Pakistan. There is no forensic psychiatry, there's no substance abuse psychiatry, there's no geriatric psychiatry, psychosomatic, so no formal training in any of these fields. We only have 400 trained, psychiatrists in the country. The burden of disease is huge, is absolutely huge. So we need good psychiatrists to come and take up advocacy, take up research, take up child mental health, take up psychosomatics, there's everything is open. Take up capacity building for pediatricians and general physicians in mental health. Take up advocacy in medical schools. AKU and maybe perhaps one or two other medical colleges are the only colleges that actually have this as a mandatory rotation. So just take that up. So there's just so much to do. the sky's the limit. So yeah, and because pathology is there, there's a lot to do.
Okay. And a question that comes up often, how's the money in psychiatry? Globally as well as in Pakistan, how have you seen the numbers compared to people in similar internal medicine, etc.? How's that been?
So it's very comparable to pediatrics, internal medicine, neurology. So some of those primary care related fields, neurology isn't, but some of the primary care related fields. So it's very, very, very comparable to those. Some people who take up forensic psychiatry actually make truckloads of money. Because there's a lot of money in divorce cases and all of those cases like that. You can also become the elite society psychiatrist and work in New York and earn huge bucks. So you can also do that. So it totally depends on what you want to do. Now, it's like it's less, not as comparable to, let's say, radiology or dermatology or surgery. But then you're also working a lot harder in those fields, especially in surgery. So I don't know if you have time to enjoy all the money that you're making. Yes, your kids can go free to colleges, you pay for them, and they don't need to ask for loans and stuff. But for you, are you sort of enjoying that much? I'm not so sure. But then again, it totally depends on the kind of lifestyle that you choose for yourself. So you make those decisions, you make those career choices, and then you live with it.
Okay. So very comparable to all these other fields.
Very comparable to medicine and family medicine and pediatrics.
So coming to the end, almost to the end, short and brief, your advice to the aspiring psychiatrists out there?
It's very, very important to deal with each patient encounter as your masterpiece. That this is going to be the best that I've ever done. I think that to me is the be all end all, that whatever you do, but especially because we are physicians first and patient care is our foremost identity, I think that's very important. That's really helped me. And sometimes it doesn't work out. I mean, a lot of times it doesn't work out. That patient was angry, as you said. But then going back and seeing what happened, what didn't go well there. So developing that sort of reflective capacity and taking pride in each patient that you touch, I think is probably my advice to the aspiring psychiatrist, that then you'll do good.
Okay. And as chair of the department, your advice to, in general, all medical students?
Do take psychiatry seriously in terms of being able to develop this as a competency. Because regardless of what you do in life, you will be seeing patients that have psychiatric disorders. A lot of patients that you'll see will have concomitant psychiatric or mental health disorders, and it's extremely important to understand them because it affects what you are doing with them. So you could be a surgeon, but if your patient has depression, the post-surgical outcome is not going to be as good. You could be a cardiologist and you've done a great, a patient come in with an MI, or you're a cardiothoracic surgeon and you've done a great cabbage. But if you've missed out that he has anxiety or depression, the prognosis is going to be worse. So it's important to take this seriously and see this as in terms of that this is as important to my care, whatever I'm doing, as any other body organ that I'm looking at and any other disorder that I'm working towards.
Right. So just to end on as high a note as I can imagine, tell us about a time you saved a life.
Ooh, okay, saved a life. I want to think I save a lot of lives, Heather. So I've had patients, especially again adolescent suicidal patients, call me, WhatsApp me time and time again that I think I'm going to kill myself, what should I do? And I call them and we chat, and I feel like, that little blip goes away. Just recently, I've been struggling with a 15-year-old patient who saw 13 Reasons Why and became so obsessed with it that was consistently watching it over and over and over again, and came to my clinic with her arms folded in a towel, and when I took it off, like her whole arms were, slashed. And she wanted to die. She just didn't want to live. And, we admitted her, and I spent many hours. I mean, since last November, I'm probably seeing her every 2 weeks, if not every week, in clinic, but also keeping in touch with her and her mother on WhatsApp, just to make sure that, she stays alive. So yeah, happens all the time. I laugh at some of my neurosurgery friends that I probably save more lives than they do. But it's just a different way of looking at things. But yes, absolutely. We have our own glory moments in psychiatry.
Okay, that's perfect. Thank you so much, Dr. Ayesha.
Of course,
for
thank you.
being our guest as well as our host. So
Thank you, Heather.
Thank you so much. We'll probably be coming back to you for a specific interview on child and adolescent.
Okay.
But thank you so much.
Absolutely. Pleasure. Thank you, Heather.